Good afternoon and welcome back to day 2 of the Chatham House Summer School. So, another day, another topic. And today it's on infectious disease, biological threats, and universal health coverage. I'm delighted to introduce my colleagues from the Universal Health Program, Ben Wakefield, Research Associate.
Thanks, Alice, and good afternoon, everyone. My name is Ben Wakefield, and I'm a Research Associate in the Global Health Programme at Chatham House. Firstly, I just want to say thank you to our amazing host, Alice, for making the summer school possible. I think it's a fantastic effort to have orchestrated such a diverse and interesting series of events this week, and I'm really pleased to have the opportunity to speak to you all about infectious disease and biological threats. And I want to thank all of you for signing on and signing up to the school, and I hope you find it interesting and informative. So 2020 has been a particularly eventful year in terms of infectious disease and biological threats. I'm sure that every one of us has been affected in some way or another by this. To kick things off, I just want to do a quick poll to see if you know what this image is. So if we get the poll options up now, just a quick question, just to see how closely you've been paying attention to the terminology. We'll see what comes in from this. This image it's a bit of a trick question. I'm not sure how you answered it. I haven't seen the results yet. It's a bit of a trick question to see how close you've been paying attention. So most of you have said this is COVID-19, but this is actually an image of the SARS-CoV-2 virion, which is the pathogen that causes the disease that is COVID-19. But don't feel bad about that. That's a bit of a mean question from me anyway. So a pathogen is a broad description for a bacterium, virus, fungus, or any other microorganism that causes disease. And this is what we refer to as infectious agents, biological agents, or even more simply just germs. And as we know, these cause a number of different infectious diseases, which are transmitted in a variety of ways and have differing levels of severities. I've listed a few of them here, just as examples. And don't worry, this isn't going to turn into a full biology lesson now. I know you're more interested in international affairs and the policy level, and so are we. But I wanted to start off with that micro-level biological impact of infectious diseases on individuals and their bodies and the importance of protecting health. But there's also the macro-level social, political, and economic impacts of disease and what these pose to nations and the world at large. Outbreaks have a wide range of economic impacts. For example, travel and trade. Travelers no longer wish to visit affected countries due to the perceived risk of an outbreak. Travel restrictions stop holidaymakers traveling, or insurers don't cover them. Flights aren't operated or they're restricted. And this can have billions of dollars of economic impact for countries, specifically those that rely on travel and tourism for the majority of their economy. And we've seen this through outbreaks of the last 20 years, looking at MERS, SARS, Ebola, and of course now with COVID-19. Unemployment and productivity are also impacted. Those who are sick or die can't work. Many won't be able to work because their industries might not be able to function during an outbreak, or they've been closed down. Trade and retail, shops can't operate as usual, similar to the above, and export and import becomes impossible or difficult. And of course, all of this has an impact on taxation as well. As employment and productivity drop and businesses close down or cease operating, then the amount of tax recovered by the government drops. And agriculture is often impacted as well. So now more than 60% of new and emerging diseases are zoonotic, and zoonotic means that they pass from animals to humans. So there's often a huge impact on agriculture as well, as any animals that might be infected have to be culled and killed. This happened with avian influenza or foot and mouth in the UK and across Europe. And animals can't be exported or traded because of the risks. And foreign investment is also impacted. Investors lose confidence in the region or the countries that are affected and no longer want to invest. And this was a massive problem in West Africa after the 2014 to 16 Ebola outbreaks. So in addition to the economic impacts, there's also the social impacts, the infectious diseases can cause division within societies or exacerbate existing divisions. So stigma can be a major issue, as those who are affected might be ostracized or negatively treated for their status. Rumors are circulated about how diseases are spread and people are wrongfully judged for being infected, or particular groups or races are targeted as responsible or guilty for the disease. Outbreaks can also highlight socioeconomic, racial, or other disparities within society. So this may be that certain groups are more vulnerable to infection or are disproportionately affected by the disease, but it might also be that certain groups lack access to treatment or advice. And it could be that certain groups are prioritized even for treatments or vaccinations when they become available. So this, alongside the economic impacts, can cause unrest within the population and cause or exacerbate fractures within society. So political impacts are, of course, closely linked to the social and the economic. An outbreak can cause a loss of trust in the government. If the public doesn't see the government response as sufficient, or it might be that the public doesn't believe in the risk of the disease or even the disease itself, this can be hugely problematic. Governments may not be able to enforce the measures that are proposed, particularly if the public doesn't trust the government or believe in the measures themselves or even the disease. There's a risk that this can result in heavy-handed responses from the police or the military. This again was a problem in West Africa during the Ebola outbreak, but you've also seen this recently in the United States in responses to civil rights protests. Then additionally, country responses can impact international relations too. For example, if country A unnecessarily restricts travel to country B when there's no scientific basis for doing so, and it severely impacts country B's economy, then there's going to be a deterioration of that relationship. Similarly, a poorly managed response may impact a country standing on the international stage. From these impacts, and of course on top of protecting human health, it should be clear why many countries are keen to protect against infectious diseases and biological threats, and why many consider this a security issue. So I want to now talk briefly about the term global health security. And I'm wondering now, who's actually heard the term of global health security before? I'm not necessarily expecting you to have done it. It's more of a technical term within the field, but I'm just interested to know who's actually come across it before. So I'll let you answer that quickly. But I'll also then skip on while you're answering that. Because health security has a number of more nuanced definitions, and there are criticisms of the term and the way global health security is enacted in the field, if that makes sense. And if you in the reading list that we shared around, we've sent you some sources on those different debates. So I won't go into them now, but you can talk on those. You can have a look at those through the reading list. But it's essentially the protection from threats to health, and it's one of the most important non-traditional security issues. So of course, the coronavirus pandemic, and before this, the Ebola crisis, highlight how quickly deadly infectious diseases can spread across national borders, and the importance of reducing vulnerabilities to this across society. So collective health security generally refers to the frameworks and systems for rapid detection and response to diseases. And historical examples of this include quarantine in the 14th century, so quarantining ships before they docked into ports to stop bubonic plague crossing borders. And now collective health security could be our systems to track, trace, and isolate specific diseases or laboratory networks. There's also individual health security, which is an individual's access to safe and effective health services, products, and technologies. So how a person can be treated or seek advice for any illnesses that they may have. And collective health security is the sum of individual health security and ties closely to the necessity of universal health coverage, which Nina is going to discuss in more detail in her presentation. And while we're talking about global health security and collective health security, I have to also mention deliberate use and biological terrorism. So in addition to the collective and individual risk to health from naturally occurring diseases, there's also the risk of the intentional use of biological agents by malicious actors, which can result in the sickness or death of people, animals, or crops. And this could be by a non-state actor, a terrorist group, or an individual, or even a state actor, though the Biological Weapons Convention prohibits the use of biological weapons. And the United Nations Security Council Resolution 1540 aims to prevent the spread of this type of material to non-state actors. There are actually very few examples of deliberate terrorist attacks, and they've largely been ineffective, but they remain a significant security risk. Systems for natural diseases can also be used to detect and respond to deliberate uses, but naturally occurring outbreaks remain a much higher risk than deliberate use. So now I want to talk quickly about Chatham House and global health. And I understand you've had a brief introduction to Chatham House and what a think tank is already. And you can see a picture of the building here, where none of us are actually there. But I want to talk through what we've done and what we've worked on over the last decade or so. So since 2010, we've been working on global health security when Professor David Heyman set up the Centre on Global Health Security. But earlier this year, we rebranded to the Centre for Universal Health under the leadership of Rob Yates. So that brought with it a shift in focus. So what do we actually do at the Centre? We're now working across universal health coverage, global health security, and social determinants of health. And fundamentally, we work to help translate research evidence into policy for better control of infectious diseases and other health hazards, and to highlight the merits and practicalities of implementing universal health coverage. And to do this, we work across multidisciplinary teams, including medical doctors, public health, global health, international relations specialists, economists, epidemiologists, anthropologists, all of the ISTs you could think of, security experts, military personnel, diplomats, ministers, even heads of states, prime ministers, presidents sometimes, and from all over the world. And because health both impacts and is impacted by so many different things, global health really is, or it should be to get the best outcomes, an extremely diverse and multidisciplinary field to work in. And that's not just the sort of sectors and people we work with. Our work also involves advising, consulting with high-level national, regional, and global stakeholders. So the World Health Organization, the Food and Agriculture Organization, World Animal Health Organization, the UN, Africa Centers for Disease Control, the military, and even security actors like Interpol when we're discussing issues relating to deliberate release. So now I'll just talk through some specific examples of our approach to the research that we do. So a lot of our work involves desk research, which is reviewing the literature. So what's been done and written about already, what knowledge already exists on these topics. It might be stakeholder mapping, so who's involved, who's affected, who do we need to speak with and work with, who do we need to involve in our work. We'll also conduct interviews with key people. These might be informal, just for information gathering or finding out what the most cutting edge problems are, or they might be structured or semi-structured interviews where we have specific lists of questions to ask people, and then we'll sort of go through and analyze the transcripts of those interviews and try to pull out the specific messages of what's important. We also use surveys to gather and analyze information. And a large part of our work is also convening people. So that's at roundtable meetings of 25, 30 people, or focus groups, which are usually smaller, about 8 to 10 people, say. And this allows us to get the right people in the room to discuss the pressing issues. And that might be convening people from sectors or regions that don't normally interact with each other, or even that find it difficult to interact with each other. So in some of the work we've done before, that's getting military personnel in the room with NGOs who traditionally don't work together to talk about the issues of how they can effectively and what the different issues are. And what we do is we'll then distill and analyze all the information that we gather from these discussions and feed it into our research. And sometimes these meetings are also done under the Chatham House rule, where the information that's discussed can be revealed, but the identity of the participants must remain a secret. And that allows people to be more open and honest, especially when we're talking about really sensitive issues. And sometimes what we'll also do is have a high-level advisory group or steering group, which might be local experts or practitioners or international experts to help advise on our projects and the way that they're going. So that's a broad overview of our research approach to the work that we do. And now I just want to talk briefly about a specific project that I'm involved in, which is the Sustainable Laboratories Initiative. So in this project, we work in close partnership with public health, laboratory, medical and military experts in Africa to improve the sustainability of laboratories for high consequence pathogens. The project aims to make these developments more sustainable and improve the collaboration between the host country and the funding partner, rather than continuing with an outdated and sort of colonial donor-driven approach where the donor decides everything and it usually ends up being the wrong thing and ineffective. So encouraging this new approach and working with African partners to drive the project has offered a number of improvements. And you can see here these pictures at the bottom are some of the designs of the labs that were developed through this collaborative approach. So you've got, the solar panels in there that act as a shading as well. So making the most of the sun and protecting against the heat at the same time. So it's more fitted to the local needs and risk. And at the top, there's the picture of the group of experts that we were working with to help develop and drive this project. And that's at one of the actual labs that was developed in Accra in Ghana. Another one here is just a picture of when I attended the meeting of states parties to the Biological Weapons Convention at the United Nations in Geneva. And it's these high-level international meetings that are good opportunities for us to interact with the relevant experts and government representatives to discuss these issues and also to present on our research projects. And it's these kinds of meetings that help us to have a policy impact and to help us translate our research from something that's just written on a book on a shelf and something that can help make something happen in the real world, actually have a policy impact, which is what we're all about, really. But that's all from me for now. So thank you for listening, and I hope that was informative. I'm happy to discuss any more of that in the Q&A after this, but I will pass over back to Alice, I think, now to introduce Nina on UHC. So thank you very much.
Thank you, Ben. Thank you very much for your presentation and for the overview of the work of the Center. May I just suggest if you may answer some of the questions that are coming through in Q&A, and of course we will also address some of them later during the Q&A, but just perhaps to keep them going, especially now as they're coming through. Nina,
sure.
over to you now. We're looking forward to hearing more about your work.
Hi, everyone. So my name is Nina, and before I say anything, I will share my screen. Okay, so I will try and keep this quite short so we have enough time to really go into the Q&A and really get into the nitty-gritty of it. So I think, as Ben sort of has already pointed out, really our work is about international relations and how health pretty much touches everyone on an individual level and us collectively as a society, and allows us to think about social inequalities because they're especially prevalent in health. So I really want to just talk about sort of universal health coverage, what it is briefly, why it's important, and some evidence on sort of where countries are in their progress towards UHC. So in terms of what UHC is, really, in its most basic form, it just means that all people receive the quality health services they need without suffering financial hardship. Financial hardship, we distinguish in either being sort of impoverishing or catastrophic expenditure, which I'll talk about a little bit more in a little bit. I'm not sure we have the poll, but in case I'll get back to it at the end, if that's okay. Right, so just to briefly go through the three components of UHC. So this cube, it's called the UHC cube, and it's pretty much the primary thing we use to discuss universal health coverage. So you can see three elements, basically. One is in terms of population coverage, which means how many people are covered within a population, how many people can access the services they need. Then in terms of services, which services are covered in terms of when people access these services, what right do they have and what benefit package they have access to. Benefit package is basically a package of essential services. Right. And thirdly, we're talking about direct costs. So what do people pay at the point of care to access health services? And so with universal health coverage, we really want to fill this whole cube. We want to get the largest amounts of pooled funds to make sure that as much people as possible have access to health services. But the problem is that most of these parts of this cube are interdependent on one another. So you can't just offer free services to the whole population without thinking about quality and without thinking about the extent of the services you can provide. Because if you have 6 million people in a population, you won't be able to provide access to really intense cancer services if that means that you lose out on more primary-based services. So I think in summary, this cube is really about political choices. And that's where we come in. We really focus on the political economy of health reforms and of universal health coverage. So what does it mean to move towards universal health coverage, and what are the political choices that countries need to make in deciding to invest in health and where? And just to say as well that UHC right now is a really hot topic. I think also in terms of global health security, as Ben said before, I think COVID-19 has really shown weaknesses in health systems that we thought might be performing better, and has shown extreme resilience in countries where we thought, that they were perhaps not very prepared for pandemics. And I think global health security is intimately related with the strength of a health system and with the strength of its public health capacities. So yeah, just in terms of this global health agenda, there were many United Nations General Assembly on universal health coverage. So the last one was in 2012. Since 2018, it has its own day, and it's an SDG target, SDG 3.8. And just in that little picture on the right, that's basically how universal health coverage is measured at the moment. So then I'm specifically talking about the coverage of essential health services. So that was that package that I was talking about before, and catastrophic expenditure. And basically what that means is that a household spends more than 10% of its income on health. So meaning that households are spending so much on health that they have to sell their assets, have to borrow money, things like that. So why is it important? I think essentially UHC is about human rights and equity. So I'm really talking about, the back of 1948, the Universal Declaration of Human Rights, the right to health is enshrined there. And from there on, we see that especially in terms of universal health coverage, we're really trying to focus on the right of everybody to receive the health services they need without having to suffer financial hardship. So here with UHC index scores in South Asia, we see the general sort of average score they have on how many services they provide to their population. So we see in South Asia that Sri Lanka, the Maldives, and Bhutan are scoring the highest. We know, for example, that Sri Lanka has had a universal health system since 1951. So they tend to score higher because they have a higher level of services they provide to the population. But it also shows that in terms of, well, actually what this doesn't show is that a lot of these gaps in services tend to be related to how much people need to pay for their health. So just to show you some key policy messages from the WHO, one for me, is that still, a lot of people are pushed into poverty because of healthcare costs. Almost 800 people spent at least 10% of their household budgets to pay for healthcare. And I think the last one is for me is that especially if you have an inadequate level of public health care, even if you might have a scheme that protects some parts of the population, that particularly disadvantages people of lower socioeconomic strata. So people, when most of healthcare expenditure is out of pocket, meaning literally out of pocket, this means that if you are from a poorer background, you might not be able to access health services. You might forego health services until it's too late, and then might have to pay for a more expensive hospital treatment. So I'll just end with, healthcare being a right and not a privilege. And so, especially from most of the evidence that we see, it can't really be ruled by market-driven mechanisms. And I'm trying to skip to the next slide. There we go. But there are also benefits to UHC, right? You can think about health benefits. UHC generally is associated with higher health outcomes in a population, reduced maternal and child mortality, and other positive health outcomes. Then in terms of economic benefits, there are strong correlations, for example, with having a healthier population, meaning a more productive population. And also, if you think back about out-of-pocket expenditure, the less people have to pay out of pocket for health, the more they have for other expenditures, which could also benefit the economy. Then in terms of political benefits, there's a reason why a lot of these universal healthcare schemes and UHC-style health reforms are named after political leaders. If you think back about, for example, Modi Care in India, the Ayushman Bharat reforms, as well as Obamacare, although that cannot completely be called UHC-style reform. And just to refer you to that picture, which was a picture of Jokowi, who was then governor of Jakarta, who introduced free healthcare services with these free healthcare cards. So just to reemphasize that point, that universal health coverage is also a strong political vehicle, and that it's mostly decided by intricate political processes as well. So just to have a quick chat on where countries are on their UHC journey. I don't want to go too much into depth into this, just to allow time for the Q&A, but I will sort of talk about some countries. So this is a timeline, and this is just to sort of drive home the point that universal health coverage tends to be implemented at wildly different price points, by which I mean wildly different levels of income. So, for example, in the 1950s, we have the UK, who implemented universal health coverage reforms just after the Second World War. Sri Lanka, who started implementing universal health coverage after independence in 1951. We see South Korea in the 1970s, which was really a flagship policy for that government. We see Brazil, South Africa for pregnant women and children, which we see a lot, which we've seen a lot in sort of African countries who, perhaps because of fiscal space, but also because of political, because of political benefits, to specifically focus on pregnant women and children. And this has had quite strong effects on child and maternal mortality, specifically, for example, in Burundi, if you're interested in that. So specifically also in Thailand, which is kind of hailed as a country who's been really successful in extending health coverage to its population. That was originally from a very populist government. And we see UHC-style policies as well in Zambia, Nepal, Ghana, Mexico with Seguro Popular, and Turkey as well. And I'm happy to go into some of these countries more in the Q&A as well. But there are some conclusions we can draw from all of these different countries and all of these different journeys. So major enabling factors for UHC include a disruption of the status quo. So if you think about, for example, independence, democratization, a change of political leadership, political unrest, social unrest, these are all factors that sort of can break political inertia and really push for health reform. So I think it would be interesting to think about as well with COVID-19, which is a massively disruptive global event that has shown a light on health and investment in health, how much that might be able to trigger more advanced health reforms in countries. Then peer trends. So in different regions, if one country starts doing it, we start seeing other countries in the region perhaps doing similar things to not be left out, so to speak. Again, there's evidence, especially sort of in the African region, there's quite a lot of sort of peer influence and peer trends. Then political leadership, I think I mentioned it before. A lot of countries say that fiscal space is a determining factor to start really investing in health and moving towards more ambitious coverage. But really, political leadership tends to be the deciding factor. Cross-ministerial collaboration beyond just the Ministry of Health, and a strong political commitment, especially at the highest levels of politics. Then the last one, public financing. Like I said, market-driven mechanisms tend not to achieve universal health coverage. As an example, for example, the US is classified as a high-income country. However, they have not achieved universal health coverage, and their health system, arguably because of, this is my opinion, but informed by evidence, is quite inefficient, as around, for example, in 2017, around a third of their health expenditure was based on administration. So having these fragmented health insurance schemes is actually really quite expensive. And so just to talk a little bit more about public financing before I stop, I think I have about 2 minutes left if I'm not mistaken, just to talk about countries and triggers. So if we talk about China, for example, in the 1980s, China really had a strong privatization drive in its healthcare, which meant that, for example, public subsidies, which were maybe around 50% of income of some health facilities, dropped down to 10%. So that had a massive impact on quality and also on access to health services. And this led to social unrest and also some political protests. Then in the early 2000s, we had SARS. And so SARS further really exposed weaknesses in the health system. So this wasn't just a health crisis, this was really also a political crisis. So that sort of gave way to a rethink. So China really announced this first additional investment in the health system around 2006 or 2007 that you can see. And then a really ambitious UHC reform program that started in 2009 and sort of is going on till today. So we see a consistent increase from 2009 onwards. And I think perhaps the most dramatic increase you can see in this graph, which is, by the way, is government health spending, so public health spending as a share of GDP, is that Iran in 2014 started a massive reform plan. This was off the back of the Iraq crisis as well. So in 2014, I think there was about a 59% increase in the budget of the Ministry of Health. And now we see that Iran is doing quite well in terms of its progress towards health coverage. And I think the interesting thing about this is that they financed it through an additional 1% on their VAT, so value added tax, as well as energy subsidies. So in a sense, they made people pay more for their gas, but in return, they offered stronger health services. So again, that talks about UHC being quite a strong political vehicle to ensure that populations get higher health outcomes as well as sort of reduce public unrest. So this is just to say, like I said, it has UHC reforms have a lot of political elements to them. So we have things like the relationship between Ministry of Health and Ministry of Finance, bureaucracy, leadership, pressure from civil society. How strong is the civil society in a country? Externally, what are donors thinking? What is the the flavor of the month in terms of in the global health community, as well as interest groups like, for example, medical associations, where doctors might be afraid that their salaries are going to drop and might resist some of these reforms. So just on key takeaways, UHC has really its origins in rights and equity. Like I said, everybody should be able to access healthcare of sufficient quality without having to suffer financial hardship. Then, strong political leadership. Without it, it's pretty much impossible to move towards universal health coverage. And then lastly, we need public financing. Market-driven mechanisms tend not to be very effective, and the state really has the purchasing power to make sure that enough money is raised for health reforms, that this money is pooled into a pot big enough to cover the population and to purchase services from providers. So yeah, thank you very much for your time and for listening to me. And let's jump into the Q&A. And we're very excited to discuss further on health with you. Thanks.
Thank you very much, Nina. Thank you. I believe we might have the survey now ready for the question that you prepared, Nina. There were also some great comments from various countries, people commenting on their own health care systems in different regions. And thank you, Ben, for answering some of the questions as well. Aswin, would you mind asking your question? Hi, Aswin. I can hear you.
Hello. Good day to you.
Hello.
My question is with regard to a global pandemic-like situation like COVID. So what would be a feasible approach to solving such a pandemic? Recently, I just read an article. I'm living in India, and I read an article saying that if the government had taken measures right from the grassroots level, instead of disseminating them from the center, we wouldn't have been having such problems like cases increasing and number of deaths. So my question is, what would be a feasible approach to solving such a pandemic in a global level?
I think that's a pretty tricky one to answer, because I think if I had the answer to that in a quick soundbite, I'd probably be on the phone to WHO right now. But just on that, I think it's very difficult responding to a pandemic with a new disease where we don't know any information about the disease, and right. Every day is a learning curve. So when we look back, it's very easy to look at what went wrong, and there will be reviews to figure out what went wrong. But I think at the time it's very difficult to have the right answers from right off the bat. But at this stage, I think it's widely understood that to have an efficient system to test, trace, and isolate cases is the best way to move forward with controlling the disease and ensuring that everyone follows the advice from WHO and the public health advice, which is to wash your hands, not touch your face, and physically distance from other people, as well as wearing a mask to protect yourself and others in the appropriate scenarios. And these fundamentals are pretty key to fighting it, and having that system to find out where cases are, find who they've been in contact with, and get all of those people to isolate to control those outbreaks as they happen. And that's what countries need to be working towards, if they're in the right position to do that. But I would just say again that there will always be criticism looking back over the last few months, and it's very easy to do that when we now have so much more information 3 or 4 months later. But it's a very interesting question, so thank you. Nina, do you have anything you'd like to add to that?
Yeah, I think in terms of the global response, I think in the context of India, and this is, of course, this differs per state, right? I'm definitely not an expert on India. You'd probably be able to tell me a lot more about it. But in terms of the Modi care reforms, they're very much focused on inpatient healthcare, right? So we see that Kerala is actually quite a good performer against the pandemic versus, let's say, other states. So I think it's, in terms of country responses, perhaps also global responses, there's a real importance of investing in public health capacity as part of your primary healthcare system. So connecting, let's say, universal healthcare style reforms with health security. And I think in the global health community, we tend to, like I said, go onto the flavor of the month. So, for example, focusing a lot on maternal and child health, or a lot on HIV/AIDS, but then seeing that NCDs are actually non-communicable diseases. So things like cancer, heart disease, et cetera, are a really large part of disease burdens of countries. Without waffling on, I think there's just linking health reforms with health security is key in this sense.
I believe we have Louisa next. Louisa, would you like to ask your question, please?
Yes, thank you. I just wanted to ask you two, being involved in like these discussions about health coverage, how do you experience the cooperation in striving for a universal health coverage, especially referring to the United States cutting its contribution to the WHO? Is this rather a single incident, or is teamwork and cooperation striving for the same goals like generally critical in these issues and debates?
Yeah, you hit the nail on the head there. That international collaboration and cooperation is key to responding to these kind of global health issues. And I think positions that the US government and the Trump administration take are problematic and unhelpful. But I would say that in our experience, or in my experience, when I work with people from the US and from their CDC or their Center for Disease Control, their public health experts, the people in those positions are always open to collaborating and wanting to do, to drive things forward in the right way. So that cooperation collaboration still exists, but it's very difficult when the captain of the ship is driving in a different direction, which I know only touches on part of your question, but Nina.
Yeah, I think there's been a real difference between the collaboration in the scientific community and in the public health community versus the real almost breakdown of multilateralism in terms of on a political level. So I think, for example, the US buying up the world's stock of remdesivir therapeutic for COVID-19 is a strong example of perhaps politically a lack of collaboration, but in terms of the scientific community, there is a lot of collaboration, and I think it's been very difficult as well in terms of the spheres of public health working with the government and having to perhaps convince political leaders of unpopular measures for the benefit of the population. So I think, it's been tricky. It's been very interesting, but it's been tricky.
If I may group some questions, I was reading through Jemima, Callum, William, Anya, Sam, and Gurmina have commented on the situation in the US. And how do you what would be your comment on US spending 17% of the national budget, but does not have a UHC and all the other struggles that put pressure on people to have very expensive coverage? Perhaps Nina, you may comment. And also from Ianto, why do some nations decide not to have universal health coverage?
Sure. So I think in terms of the US situation, it's again, it's a tricky question, right? Because it does spend a lot of it on its healthcare, but not a lot of necessarily public spending. And I think the way it spends healthcare and the way the healthcare system is organized is, in my opinion, very inefficient, because you have fragmented health insurance schemes that are directly related to your status of employment, which means if you lose employment, you more often than not are left without access to healthcare services. Then there's the issue of cost sharing or co-payments, right? So even if people have health insurance, they tend to have really high contributions to be able to access health services. And then in terms of when they do come across a perhaps very unexpected and serious health issue, for example, talking about cancer or a very rare disease, or even something a little bit more than preventative health services, they tend to go over these co-payments, go over this limit already, which means that they are at risk of catastrophic expenditure. Plus, there's a whole thing about hospitals, you know, suing patients for non-payment. So I think if you have a market-driven system, it doesn't have the protections in place to protect people of lower socioeconomic strata of healthcare costs, which is also why medical expenditure is one of the highest reasons for bankruptcy in the US, although the data on that does differ and is a bit tricky. In terms of the second question, why countries wouldn't choose to move towards UHC? Well, because there's a perception that it's a very costly exercise. I think generally from empirical evidence, ministries of finance are hesitant to fund health in general because the returns tend to be on a longer term basis. Then also in terms of, you know, there is a perception that it is very costly and that, you know, they don't have perhaps the capacity to implement it or perhaps the finances to implement it. But in reality, we see that more often than not, that in terms, it's about political choices, right? That I was talking about before. It's about prioritizing health, and it's perhaps using other sources of financing to cover the health of your population. I apologize if I'm going on too long. That's it for now.
It's okay. Let's unmute Joseph so he can ask his question, please. Joseph.
Yeah, thank you. So as an American, I'm naturally a little skeptical to the idea of universal health care. Although the US's response to COVID-19 has been all over world news, the UK still has far more deaths per capita due to the disease than we do, 674 per 1 million compared to 413 per 1 million. Does a private health sector not allow for a much more flexible and quicker reacting system than a largely government-controlled one?
Thank you, Joseph.
Thanks. I think if I kick off and then I'll pass on to Ben as well to talk more in detail about infectious diseases. But I think there's a conflation here about the strength of the health system in general and the strength of a country's public health capacities, right? So you can't measure a whole health system by their response to a particular infectious disease threat. So in my opinion, specifically, there have been some crucial mistakes from the UK government initially in terms of the response to this particular threat. However, in general, the UK NHS is a health system that is relatively efficient. I'm not saying that it is perfect, but in terms of equity and in terms of access, it does tend to perform quite well. And just to go back to the US, I think the specific thing in terms of efficiency of a health system to respond, I think in the US there's a strong problem in terms of access and equity to treatment. In April, I think there was a poll done that about 13% of Americans said that they were not going to access COVID-19 testing or treatment because they were afraid of costs. So, and I think in terms of the response, the turnaround as well in the American health system has been relatively inefficient because there were difficulties in terms of procurement, in terms of the coordination between different states. So I think it's very difficult to sort of say that a whole health system functions less well because of their response to a particular threat. And I'll allow Ben to come in as well.
The only thing I would add to that, but I'd say the comparison between the US and the UK is probably a tricky one to make. And I would also caution against direct comparisons of numbers between countries because it depends on reporting and the definitions that we're working with. But I think it would be a little insincere to suggest that the US has done better than the UK at this point, even if I would urge against waiting for country comparisons.
I think we have a couple of minutes left maybe for another group of questions, and in particular those questions about the role of Chatham House in this. And you talked a little bit about influencing and about getting people together to talk about issues. But in particular, for those who are asking, how do think tanks work with NGOs perhaps such as Gavi or CEPI, to implement health policies and initiatives? Thank you, Anna, for asking that question. And for others, how did we respond to COVID crisis, and in your team, I know you have been giving briefings on a weekly basis, but perhaps a little bit more about that political influence, about, reaching out to different constituencies and stakeholders.
The way we work with sort of different sectors and different partners depends on what the project is. But, NGOs are a sector that are a commonplace at our meetings. One of the projects I worked on before is on urban resilience and preparedness to biological threats in West Africa. And we were looking at city responses to biological threats, whether that was deliberate or natural disease outbreaks. So we'd have people around the table from academia, from public health, from hospitals, from emergency management agencies, from local NGOs, from international NGOs, so everyone that would be involved, even the private sector as well. So all of the different moving parts, and the role that they would have there is to each different sector can discuss and put forward their point of view and how they fit into the system of that, and sort of share those ideas and how to improve that system, if that makes sense. But the role can vary depending on what the project is and what the intent of the project is and what the outcomes are, or what they're planned to be.
Thank you, Ben. Nina, can I come back to you for maybe a few final remarks? Maybe you want to comment on the poll that we've sent just before the end of your session. And perhaps if I can ask you to stay with us for maybe another half an hour to clear some of the messages from the Q&A box, if you have time. That might be maybe useful when we have the next session on. Thank you very much both for your presentations. Nina, over to you.
Great, sure. So I think in terms of the reason why I asked this question is really because there are no wrong answers. The answers to the question are, let's say, the building blocks of a health system. So in terms of, and I think most of you now replied access to essential medicines, which I think is telling, because that basically tells a story of perhaps access to a COVID-19 vaccine and perhaps lack of access to essential medicines in countries. And in fact, the largest source of out-of-pocket expenditure tends to be on medicines, which tells you also a little bit about, private providers, about the lack of regulation of medicines as well in countries. So I think, all of your answers were really great, and all of these things are important. And I hope that we, spoke a little bit about the connection between, let's say, collective health security and health systems, because these things don't operate in a vacuum. And I think the pandemic has really shown gaps in health systems. So we talked about the UK response that, in the Global Health Security Index, which is the measure of how prepared countries are for these types of outbreaks, the UK scored really high. The Netherlands scored really high, but they were impacted quite heavily by this crisis. So it points attention towards investment in public health capacities and investment in essential services that are really important for the resilience of health systems. Not sure if Ben wanted to say anything else. I'm happy to stay on a little bit to talk in the chat. I'm seeing some really cool comments coming through.
No, nothing to add on that particular question, but I'm also happy to stay on the chat to type out any remaining questions as well. That's no problem.
I was hoping we would have a chance to talk a little bit more about your career paths as well, which unfortunately we don't have time for, but maybe there will be some of the questions relating to that as well, and how to get in this particular sector and working on these particular issues, which are of course very important. But Ben Wakefield, Nina van der Mark, thank you so much for joining us today. It has been really a pleasure to have you on the panel. We will try to go through, I think we have about 69 questions in the Q&A box. We'll try to go through as many as possible. And please do reach out to both Ben and Nina via LinkedIn or the contact form on the Chatham House website if you have any other questions. And I'm sure you will both be very happy to answer those individually. For the time being, thank you and goodbye. So in preparation for session 4 today, which is a very important session on critical thinking and you know, how to analyze what is seen in the news, we gave you a little bit of a homework to do, and we hope that you managed to watch the video, which I shared the link with. For those perhaps who were not able to see the video, I can send you the transcript as well by email later on. But while we are waiting for our new panelists to join us, we will try, as I said, to go through as many questions from the previous session. Thank you very much to all those who asked the questions in person. It was lovely to hear your voices. And we'll welcome our next panelist to session 4. So hello to Dr. Champa Patel, who is the director of the Asia Pacific program at Chatham House, and a warm welcome to Benedict Flett, who is intern with the Global Economy and Finance program at Chatham House. Thank you very much for joining us today. It's great to have you on. This panel in particular. Instead of me doing the introductions, I think we can jump straight into the session because we have 30 minutes and a lot to go through. So Champa, over to you.
Thank you, Alice, and it's great to be with all of you guys who have joined us for the summer school. Please do send through any questions that you have and we'll try and cover them off. It's only 30 minutes, so we're really only going to scratch the surface of the actual issue. But what we want to do is give you a few pointers to think about as you approach how you do your own critical thinking. Benedict, did you want to add anything?
No, I have nothing to add to that, just to say thank you to Alice as well, and it's great to be with you guys and with Champa, and I hope we can, maybe scratch the surface, but it is a big topic, and we will just be giving you pointers. Yeah, so what we did was we gave you a transcript of a speech to have a read of, and I'm hoping that some of you had a chance to read that, which is about Trump's notice that he wishes to withdraw from the World Health Organization. And perhaps it's fortuitous timing that we've come up to the health session in terms of the topic that we asked you to look at. But essentially it was to think through how would you approach that piece of news critically. And what we did was think through, well, what are the sort of skills that you need to engage with that kind of content in a way where you're able to inform yourselves and come to kind of conclusions that are based on a set of processes that you've taken place. So one of the key things that we think that you need in order to be a critical and reflective practitioner is to ask the key questions. So number one, who, what, why, where, and when. Contextualize the piece of news that you're receiving. So don't take anything on surface value. When you read that speech, ask yourself, who is the audience for this? What is the intended purpose? Not what it says in the actual transcript, but what other purpose might there be for this particular speech? Why would they want to do this? Where did it take place? When did it take place? So I think they're the sort of key questions that you want to ask yourself when you're consuming news. And in a way, approaching it like you're some kind of detective, like investigate what information is out there, evaluate what you can find, and then do your research and read as widely as possible. So the second thing I would say is don't just read from your preferred sources of information. Like it's really easy to go to your newspaper of choice, go to your social media, kind of people that you follow of choice, but test yourself, challenge yourself to read wider than that. And I know it can be difficult because even if I have to read something that's run by somebody who I really disagree with, I can just find it really irritating and annoying. But it's important to do that because you need to understand how different people see the same piece of information and not to get stuck in groupthink where what you believe is reinforced by things that you read around you. So it's really important to read as widely as possible. The third thing that you should do to improve your critical kind of skills is to practice active listening. And active listening is where you listen to things, ask the right questions, and then see what the responses are. So for example, in your research, if you're required to do a lot of interviewing, make sure that you're really listening to what people are saying to you. Because the easiest thing is to engage in a dialogue, react to respond to what the other person is saying, but how much are you really looking to have the things that you believe confirmed, or how much are you really hearing what they're saying and listening to what's being said between the lines and thinking through why they phrase things a certain way or another way. So I think producing, like kind of working on your active listening skills is really, really key to make sure that you're critical in your approach as to how you engage with news. And some of that might be to think about counterfactuals. So a counterfactual is when you ask yourself, well, what if? So you play out potentially future scenarios. So if you read that and you think, okay, so what if Trump does withdraw from the World Health Organization? What are the likely consequences that follow from that? Are those the consequences that you think he is intending to have, or are they unforeseen consequences, and what might be the impact of those? So it's always like a detective, follow the string to kind of think through, well, should this thing happen? If it doesn't happen, what does that mean? So if he said all of these things and it's to play to a particular audience and it doesn't happen, well, what are the consequences of that as well? So I think sometimes engaging in a counterfactual helps you tease through the different scenarios that might come to play. And I think the final thing I would say before handing over to Benedict is to kind of, and this happens over time, you know, as you do it more and more, is to think through how do you reflect on content. And that's basically about your own self. Like everybody comes to the table with their own experiences, their own biases, their own way of seeing the world. And how much are you interpreting the information you hear through the prism of your own experiences? So I think it's just to be self-aware about that, about how you position yourself in the things that you're hearing. And then thinking through, well, how much is that impacting how I'm analyzing this? And am I getting in the way of analyzing this because I'm not being honest enough with myself about how I feel about this particular thing? Do you see what I mean? So I think it's something to think through. How are you engaging with the material? What kind of does it trigger you in any way? What kind of response do you have to it? Can you put that to one side in order to look at it in a more dispassionate way or more detached way? If that's needed, is it needed to be detached? And it depends on the content, right? So I think these are some of the ways I would say in which you can improve your critical skills. Benedict, did you have anything more that you wish to add?
Yeah, thanks, Champa. I think you've said the most important things in a very lucid way, but I will just add a few more things, perhaps briefly by stating the history of critical thinking as an educational goal, because I think probably that's ultimately what you guys are all looking to develop. It's how to use the skills associated with critical thought to improve your own ability to make sense of this chaotic world which we live in, where there's an excess of information, a complete glut of different perspectives, and a lot of it is fake. So you need to mobilize these skills in order to improve your ability, not only to make sense of it, but then also to fine tune and hone your own ideas. So just briefly, critical thinking as an educational goal can kind of be attributed to John Dewey, the American philosopher, who liked to call it reflective thinking. And on that definition, it's like active, persistent and careful consideration of any belief or supposed form of knowledge, including your own. I think that ability to take stock of your own ideas in as much as possible, a kind of detached way is central to the point of it. So I think you can kind of distill three features from critical thinking. The first one, you might say, is that it's done for the purpose of making up your mind about what to believe or do. And in order to do this, you have to engage in modes of thinking which fulfill certain standards of adequacy and accuracy. If the thinking that you do fulfills those standards, then you can say that the overall critical thinking process is sort of careful and goal-directed thinking. Now, I agree with Champa about what she said completely about reading widely, active listening, and engaging in counterfactuals. In order to do that, I would just add a few more kind of phrases to bear in mind, which I think are helpful and related. So attentiveness. To be a critical thinker, I think you need to be habitually attentive to your surroundings, not just your physical surroundings, but then also the virtual surroundings in which we spend so much time. So noticing trends, threads, noticing when one thing is described in different ways by different people situated in different contexts. This attentiveness is all part of a habit of inquiry. But this has to be effortful. It doesn't just, it just comes. So you have to be willing to think critically, which does require kind of mental energy and initiative, rather than just waiting to be told what to think by people on the news. You need to come to it with this attentive, energetic, engaged stance, and also an open mind. A dogmatic attitude is completely contrary to the goals of critical thinking. And I'm certainly not there. There's a lot that needs to be kind of internalized in order to come at anything with an open mind. So it's a journey, but definitely one I think is worth trying to pursue. Part of it is also the willingness to suspend judgment, which is related. So you have to be aware that like prematurely closing your mind will block critical thought. And trust in reason, I think, is also another important part. Historically, that's been kind of the underlying thrust of critical thinking, is trust in reason and science. Now, both those things are coming under quite a lot of attacks in the media at the moment. And I think the transcript that we sent you is a prime example of that. So in order to be a critical thinker, you have to show a lot of skepticism when it comes to the kind of anti-intellectualism that, like President Trump, is probably the prime example of today.
Thanks, Benedict. We've had a few questions come in, so I don't know, because I'm conscious of time, but maybe if I call on the individual, then you can come in and ask your question. So Charles Madison, are you able, I can see your question, but I wanted to know if you wanted to read out loud for everybody else as well.
Okay, Freddie, you go first.
Yeah, hi, can you hear me?
Yes, we can, thank you.
I asked this on the chat, but I just thought I'd like raise my hand. So I was just wondering whether like these, as Champa identified, these like theories of like, or these practices of critical thinking, should they also apply to like general political conversations like we have with other young people? Or kind of should they strictly apply to like the content we absorb as we all absorb while watching TV and like Twitter and social media and stuff like that?
Yeah, no, it's a really good question. I think it's actually about how you choose to engage with the world, because I think the skills that we're talking about cut across lots of different things. It's not just how you consume news, it's how you engage in whatever your profession is. You know, active listening in particular, I worked in healthcare for a long time. And to be able to kind of work with patients, you need to be really good at active listening in order to understand the sort of complexity of issues that somebody might be dealing with. So I think it should be seen as a set of core skills that help you in all dimensions of life. But when we live in an age of information overload, and where it's very difficult to disentangle what might be from all the sources of information out there, I think it's, you know, think about how you use it in all avenues of life.
Let's go straight to Aswin for the next question. Aswin, can you hear us?
Yeah, I can hear you. Can you hear me?
Yes,
yeah.
Thank you.
Yes. My question might be a bit amateur, but how can I form an opinion in international affairs? For example, I read a lot of articles and magazines like The Economist, Foreign Policy magazine, and I just reproduce the opinions which I read over there. But I feel that I need to be more original and something which comes out from me. And what would be your advice to help form an opinion that matters?
Yeah, and I think it's really challenging because, yeah, how do you form your own thoughts when there's so much thinking out there that you can borrow from? And I think it's like when you read widely, you have to figure out what set of, it's kind of like, I think that's where analytical skills come into play. So how are you synthesizing the information that you're reading? How are you evaluating it? How are you making sense of it? And I think when you know you're there, when you think, well, hang on, your evidence doesn't stack up to this claim. So when you make a claim like this, it would be very easy for me to parrot that. So for example, if Trump says China is dominating the World Health Organization, well, how? So if you're able to see that the evidence that's provided for that claim doesn't stack up to the reality, you can kind of disassemble it. So I think it's making sure that what claims are made, any claims that are made, are backed up by evidence that you can see for yourself to feel confident, okay, this is a view that I feel comfortable holding. So I think that's where analytical skills come into play, to try and figure out how do you kind of find your own position within the sea of information that's out there. Benedict, did you want to add anything?
I generally agree with what you said. Deconstructing in a kind of logical, analytical way is the first thing to do, and to compare whatever it is, whatever text or whatever soundbite or whatever, with all of the other things that are out there. But if it doesn't happen, and it often doesn't to me, you kind of expect this sort of fully formed opinion to be there, but it doesn't always work like that. So what I find is that after kind of absorbing a large amount of material around a given topic, after a little while, perhaps triggered by something on the news that reminds me of it, I will find that this judgment I have made has almost happened naturally. So this is kind of the obverse of what I was saying about the kind of active engagement, the mental kind of energy that you have. There is also a way, I think, in which opinions do come if you let them.
Yeah, and I think there's a lot of pressure on people to like think they know everything, and it's okay not to know. It's okay to say, I don't know, I don't have a view, I'm still thinking through this. And I think oftentimes there's a lot of pressure to have a fully formed view. And as you go through your professional life, or even your personal life, your views will change. What you believe at 18, you might see differently at 28, and you might see differently at 38. Yeah. And I think, it's kind of like we need to be okay to say, I don't know, I'm still figuring it out. So that would be my advice, to say, don't be scared to say, I'm not really sure, I'm still reading around this, I don't have all the answers, and I'm not really sure where I stand on it, which can be hard when you're in an environment which wants you to have a view. But I think it's okay to say that.
Yeah, the ability to do that is a hallmark of a critical thinker.
Yeah.
Sorry, we have a comment from Neve Duncan. I don't know if you can see it, both of you who saw the video and provided a little comment. Maybe one of you can discuss this a little bit, or perhaps give your overview. In particular, how can populations or individuals remove themselves from nationalistic pride and beliefs in the context of understanding news or information, especially when this can cause discomfort? And then we'll go to Charles and Viandito next.
Yeah, so I think this is a really interesting one, because it's a live debate at the moment, like with the rise of sort of nationalist, populist governments in many parts of the world. What you're seeing is a rewriting of the historical narratives to some degree, or a repackaging of them. And that's not new. All eras have their attempts to kind of conceptualize the past in a way that suits the present. But I think what you see now with the Black Lives Matter movement and some of the other movements that you're seeing in the UK around kind of, rethinking the curriculum around what are we taught in this country. I'm in my 40s. I was never taught about empire. I was never taught about colonialism. I went through my entire education, never told about Britain's role in those sort of, large historical processes. So I think, the way to step outside of that is to recognize that people, events, processes are going to be complex, and they're going to be messy. So to Charles' question about somebody like Churchill, it is perfectly possible for an individual to do great good and great harm at the same time. Now, he did great good because he believed in the European project. He did great harm because he thought people from from India or any parts of the developing world were not of the, were subhuman. They weren't the same level of humanity as white European counterparts. It is possible for one person to be both. And I think, the danger is that we fix into binary positions. Churchill is a god. No, he's not. He's the devil incarnate. But actually, he was both. And I think as part of being a critical thinker is being okay with the messiness, being okay with the shades of gray, being okay with, I personally am not a fan of Churchill, but am I really going to say that he didn't play a pivotal role in what happened during World War II? That would be crazy. So I think it's somehow learning to be at ease with the messiness and learning to kind of appreciate historical figures or even contemporary figures in terms of the three-dimensionality of what they are and what they represent, which can be challenging. You know, in a way, you could argue, I'm here because the British were there. You know, how did my grandparents end up in East Africa? Because the British took them over to build the railways. How did they end up here? Because that's where we came when the UK needed to rebuild itself after the war. So I think it's, when it gets tangled up in your own personal history, you can have a very emotive response to something, but that's where you have to check, like I said, your own kind of responses. Think, well, hang on, am I being triggered because I think this person starved 4 million people to death? Why should he be lionized? But if you step back from it, he also did this other thing. So I think it's how do we get okay with not just messiness, but seeing things in a three-dimensional way. Benedict?
Yeah, I think that's really well put. I completely agree with what you say. I think probably the Brexit debate was just a prime example of how positions can become so entrenched on both sides that actually the gulf becomes completely impossible. And I think even still, we've left the EU. If you look even a little bit on Twitter in the relevant places, you find that there are whole swathes of people, millions of people who completely refuse to engage with the other side. They either have taken the position fully for or against, and there is no nuance at all. I think even at the start of the debate, there probably was, and most people could make an informed judgment while still recognizing that the preferred way was not the only way. But it seems to me that as it wore on, it became just increasingly polarized. And the coronavirus pandemic, I think, actually, in a weird way, has kind of reflected that. And it's the divisions we've seen from that have, in some way, been born out of the same Brexit division. And just if you're interested, I read a really good book at university called The Righteous Mind. It's by a guy called Jonathan Haidt. Some of you may have heard of him. So social psychology, and it talks about, his metaphor is the elephant and the rider. And the basic point is that if you want to try and change someone's mind, you don't talk to the rider, which represents a kind of conscious thinking mind. You have to somehow talk to the elephant, which is the metaphor for our intuitions, to the things that we take for granted and don't really have a kind of conscious command over. He explains it much better than that, and obviously, and provides some strategies for how to talk to the elephant. But that, I think, is at the root of many of the problems that we're grappling with today, is that, and social media enhances that, we don't know that by criticizing we're not going to get anywhere, because it doesn't address it.
I think to some of the comments that have been made in the Q&A box, one of the participants has asked, can they be right and wrong though? And I think there is a risk in understanding things in their complexity. What you don't want to do is fall into relativism. What you don't want to do is end up in this thing where all voices are equal. And down that path leads you to Holocaust denialism and some of the crazy stuff that's out there on the internet, like, the slave trade wasn't that bad, blah, blah, blah. So, but the challenge is training yourself to be able to recognize that a solid set of facts, evidence, supports the claims being made. So when a claim is made, can you trace it back to a set of facts that are empirical, that are verifiable, that you can find, that you can read yourself? Then I think you can be assured in what's right and wrong. Now, a lot of stuff is said now that serves a political agenda, but isn't really backed up by any set of recognizable facts. So I think in that sense, we do need to be able to distinguish against right and wrong. And then it goes to another question that was asked around, do we disregard those with alt-right or controversial contrarian views? I think it's very dangerous to disregard those views. That doesn't mean you regard them, but it means you have to understand what sits behind that kind of thinking. Because if you don't understand what sits behind that way of thinking, you can't change it. So I think, some elements of cancel culture, or what people derogatively call cancel culture, the question is, how can you have the debate about things that are difficult to talk about in a way that's respectful on both sides? But not engaging can't be the answer. Like there's going to be stuff out there that I don't personally want to read, but I should be interested in what lies behind why that person said that thing or did that thing. So I don't have to like what they've said, but I should try and understand why they said those things. Because if I don't understand why, if I don't understand the why, then you can't change it. So I think there's a risk in saying, you can't say that, we don't want you here, so we shut down the conversation without understanding the why.
Thank you for that. We're going to Viandito next. Viandito, can you ask your question, please?
Yes. Hi. Can you hear me?
Yes, we can.
Yes. Okay. So in journalistic publications, claims tend to be very poorly sourced, or sometimes can come from press releases of studies without like actually considering the meat of the study, or tend to be sort of distorted. So I was just looking for your advice on how to effectively source claims.
Yeah, and I think this is why I think the best way to approach it is, when I worked in Amnesty International, which is a human rights organization, we always talked about investigations. So we never talked about kind of content, because I think it's about that mentality where you have an investigative approach. Like there's some solid world-class investigative journalism out there. And it's not necessarily always going to be sourced because of, you know, confidentiality, protecting their kind of sources, etc. But I think, you know, look at that publication. Does that publication serve a particular agenda? So for example, if you're reading the Times in the UK, you know that it's going to be centre-right. Well, right. Well, it depends. Some people might think it's centre-right. I might think it's right. If you're reading The Guardian, it's a left-wing paper. So I think it's understanding that the publication you read, where does this sit on the spectrum? And then as much as possible, read widely. Read widely to see what other people have written about this issue, and see what other sources you can find out there that can help you understand the story that you're reading. Because there's a hell of a lot of good journalism, but it's a lot of bad journalism as well. So I think it's kind of approaching like a detective, see yourselves as investigators, and think through how you can kind of dig deeper to find out what more is going on.
Thank you for that, Charles. We can't hear you. We can't unmute your microphone. And I believe, Louisa, we heard from you earlier, so I hope you don't mind we jump on to Chandramouli next. Hello, can you hear us?
Yes, can you hear me?
Yes, we can.
Yes, so I'm interested in, okay.
I'm interested in,
actually what?
It looks like he's smoking, right?
No, I'm not. Okay, so my question is actually, what is the proper way for a school to implement critical thinking to their students? Because I see that critical thinking is actually an important skill in these times. And I believe that most schools in my country, which I'm coming, is Indonesia, doesn't really implement critical thinking. That made, you know, certain generation doesn't have, you know, they like become ignorant and something. They really become ignorant to real facts around them. And I believe that's because the critical thinking system is not built well in them. And what is your suggestion to education system for that?
Chandramouli, which country are you from?
Indonesia.
Indonesia. Yeah, you know, it differs, because if I think about where I really learned kind of the good core skills around it, it wasn't at school and it wasn't at university. It was actually when I worked in health and social care, because a big core part of health and social care is participatory techniques, participatory research, participatory knowledge sharing, you know, where you kind of build knowledge with the community that you're serving. And I think working in that environment, learned a lot of skills about how you do that really well. And the person that I came across that I think has really informed how I approach these things in the work that I do with other kind of people is Paulo Freire, Pedagogy of the Oppressed. I cannot recommend it enough, because what he says is, you know, when we use this language, and I work in the human rights humanitarian field, but when we use this language of going on mission, or kind of disadvantaged people, or capacity building, we act like people are empty vessels, right? Like they have no knowledge of their own. So what he talks about is the role of the facilitator, how you as the researcher or the community practitioner or the educator or somebody who wants to learn more about something, how do you interact with people in a way where you promote dialogue, where you build on the knowledge that they already have. So I think it's a really slim book. It's not very big. Paulo Freire, a Brazilian kind of educationalist called Pedagogy of the Oppressed. I would recommend that, because I think it's don't look for systems or institutions to give you those skills. If you see it's not happening, find a way to get them yourselves.
Thank you, Ben. Do you have anything to add, or?
Add to that, no.
Let's go to Joshua next. We are slightly over time. I hope you don't mind.
Yeah.
Joshua, would you like to ask your question, please?
I'm just going to answer Freddie's question while we're waiting.
Yes.
Which was, how do you respond to positions that directly affect you or your own friends, for example, on women's rights, LGBT rights, racial minority rights, etc.? I think this is a really hard one, because often what happens is, well, this is what happens with me anyway, your first response is emotional. And it's usually like you're really angry or you're upset or you're frustrated and you're like, why should I bother engaging with this person who's got these views that I find so offensive, right? So in a way, I think the challenge actually is how do you get past yourself to figure out if this is a conversation worth having? Because sometimes I think people say things in a clumsy way. So I think intent is really important. Is that person saying something that I find offensive because they genuinely believe it, or that they just don't know any better? And if I think it's that they don't know any better, then it's worth engaging in a conversation with them. And if I think that they're, you know, just stupid, then it's different. It depends on the context. If I'm at work, I'd have no choice. I'd have to engage with them. But in my personal life, it really depends.
Shall we try? Shall we try to reach out to Joshua again, or?
Sure. I'm going to keep going through these until
somebody else can. Yes.
Angeline asks a really interesting question.
Hello?
Oh, Joshua, we have you online.
Oh, sorry, I think there was something wrong with my mic.
No problem at all, Joshua. Please do ask your question.
Okay, so do you think that is always important to stay away from biased sources of information, because there is always that risk of them giving you their opinion and that kind of forms your opinion first? Or do you think that's important to kind of form your own opinion?
Yeah, I think you have to read widely, and that includes sources that you would not normally read. Like I have a very good colleague who I worked with in human rights for a long time, and she absolutely refuses to read center-right publications. She won't read The Economist, which is quite mild compared to some of the crazy that's out there. She's like, oh, I'm not reading that, neoliberal economics, blah, blah, blah. And I think it's insane, because how can you not read it? You need to understand, if you don't agree with it, you need to understand how the other side thinks. So I think read widely, because also you'll start to see what your own triggers are. Like, what's the stuff that you find objectionable? And then kind of check yourself, like, why do I find this objectionable? Is it because I've got this particular way of seeing this issue that I don't like the fact that they don't see it the way I see it? So I think you have to read widely.
Don't you think that, oh, sorry, keep going.
No, go ahead, Joshua.
Don't you think that it's better to find unbiased information first, so it has no opinions or anything to sway your opinion, so before listening to anyone else, you kind of form your own opinion, then go out. I guess
the problem that you have is it's so different a landscape to when I was younger, where you had like maybe 5 channels on television and 5 newspapers that were read nationwide, and the BBC, which was the most trusted source. Now, I think you have such a multitude of sources. What does it mean to be unbiased? So I think, it's kind of like there are certain sources of information. I think the BBC is very good. So you have to identify which are the sources of information where verification and kind of editorial oversight is strong. And like you say, go to those things first. But you also need to read widely as well to understand how other people have defined or interpreted the same thing in a very different way. So I think it's kind of like, know what the trusted sources are, go to them, but also read around that as well.
Okay, thank you.
Going to touch on Angeline's question that I started.
Okay.
Because I think it's a really interesting one about the role Orientalism plays in how we in the Western world perceive and read the news, specifically about Asia and Africa. And I don't know if people are familiar with Edward Said's whole theory about Orientalism, but I think it's rife. It's rife in the sectors that I've worked in that you would think would be somewhat immune to that because of the nature of the work that they do. So in the human rights and humanitarian context, the kind of white savior mentality, the language that's used to describe poor developing countries or poor people is actually quite coded. So I think in a way, again, part of critical thinking is when you look at how a situation or a country or a group of people is described, how often do we talk about China is a problem, but we don't say the Chinese state. So somehow we kind of conflate Chinese people, the Chinese state, Chinese culture into one homogeneous entity without really thinking through what do all these different levels look like. So I think it's kind of like, you know, as you kind of develop your critical thinking skills, try and see how countries in the West that may want to maintain their political or their economic dominance, who are not used to a world where power is shifting east, how do they then talk about the rest of the world? And I think it's very interesting, you know, in the UK, we talk about Empire 2.0, where the UK outside of Europe now wants to be friends with everyone. But sometimes the way in which it talks about those friendships is like imperialism light. So I think it's that coded thing is usually about power and about wanting to maintain one's position or power in the world and feeling that maybe ebbing away a little bit.
I believe we can go to Karina next, and maybe then Ben, we can provide some sort of wrap-up points or key takeaway notes before we close the session. Hi, Karina.
Okay, hi. I have a question. It's actually something I've been struggling with for a while now. So I've been considering, I've been thinking a lot about religion specifically, because in my country, Indonesia, it's almost as if you don't believe in your religion, you're basically wrong. And religion is just so coded in our community that if you question it, it's practically wrong. But the thing is, I like to explore more avenues in life and also many things, religion, how it relates to our lives. But the only evidence I can find of, you know, religious truth or evidence, at least that religion does exist, is through holy books. In my religion, Islam, we have the Quran. Maybe for other religions, they have the Bible, maybe for Christianity and also Catholicism. But I'm sorry if I'm wrong. I'm sorry. I'm not that very informative, because in my country Muslims are the majority. So I'm still a bit unsure how I would think or go about thinking critically regarding absolute topics such as religion without offending anyone, without losing touch with my own God, and basically not to have any confusion at all. I hope this makes sense, because I did not think this through that well.
No, it makes sense. I think it's always very challenging when you talk about faith and try and apply an analytical to faith, because faith is so much about belief or suspension of belief and invest in hopes and aspirations in an idea of something greater than the individual, right? But I think the one way in which you can approach it critically, and I would say in Indonesia it's difficult, and in Pakistan and many countries in the world we have very strong blasphemy laws. So it makes it very hard to have an analytical approach to religion when the legal framework around that is so strict. It makes it very difficult to actually do that. But one way is to distinguish between personal faith, personal religious faith, and organized religion. I think one can analyze organized religion and look at institutions, systems, cultures, processes. How has religion been organized? How has it been disseminated? How has it been used to control or punish, or ideas of reward? And kind of make a distinction between that and personal belief. And I think one is how power operates, and the other is about how one understands their role in the world. And I think sometimes that distinction helps then to think through questions around religion, because it's not really, you know, and it's not that they're so distinct that in looking at organized religion, it doesn't then make you question your own faith and your own practice. But I think it's recognizing that organized religion is a discrete set of institutions that can be analyzed in a way that's really quite interesting. Like when did it take hold? How was it kind of, by what means was that, how did Indonesia become majority Muslim? Because it never used to be. So I think there's a historical kind of story there as well that's quite interesting as well. So I think I would probably approach it that way.
Thank you, Champa. Ben, over to you for some final thoughts of the day.
Okay, well, just to wrap up then, I thought I'd give a little overview of some fallacies that you might be able to find in the transcript that we sent.
Yes.
Fallacies are kind of the thing that you don't want. They're obviously the antithesis of critical thinking. The straw man fallacy, I think, is one that Trump used a lot, and it's when you take a point, some other person's point, distort or exaggerate it in a kind of extreme way, and then attack that. So when Trump talks about building a wall on the Mexican border, and then says that those who oppose it are therefore open borders, he's making a straw man argument. He's essentially rejecting any reasonable grounds of opposition on the basis that those who don't like his plan are for completely porous borders. Another thing he does in this speech a lot is appeal to emotion. So outrage, scare tactics, wishful thinking, nationalist kind of groupthink, and repetition. You also find in this transcript, like he says, like no one has done before, at least 3 times. That's one of his favorite tropes. And then like a formal word for basically insulting people is the ad hominem fallacy, where you attack your rivals and critics. Those attacks themselves are just part of an explicit or implicit, basically childish mode of engagement with people who think differently. But I think when you can put a name to some of these things, it can help identify them, and in turn that improves your ability to oppose them and get rid of them from your own thinking.
Thank you.
One thing I would add to what Benedict said, and we've kind of touched on this, is don't be so absolute in your views, because trust me, they will change at different stages in your life. And I'm not saying don't have core set of values. Like, you have to know what you stand for and how you want to engage in the world. I'm not saying that should be shifted. Like, if kindness is important to you, be consistently kind. Like, don't change being kind. But what you think about something should be open to change. It should be open to like thinking about things in an ongoing way. Because what you don't want to be is somebody who just has absolute views. And then you be my dad, basically. You just refuse to listen to anybody else and not change your mind on anything. So I think it's really important to kind of like have a core set of beliefs and values, but be open to kind of engaging on things and be open to the fact that your mind might be changed.
That's a great sum up of this day as well. A lot of things to think about, and thank you both for sharing your personal insights as well. It has been a really enjoyable session. I'm sorry, Mohammed and Daniel, we didn't get to you, but please do send your questions and I'll make sure we answer them individually as well. Well, we are closing day 2. I hope you enjoyed your time with us. Tomorrow we have climate change, and we have a lot of tips on how to prepare for internships and work experience, and how do you brand yourself as well. So I hope that will be another interesting day. In the meantime, thank you again. Thank you, Champa. Thank you, Benedict, for joining us, and enjoy the rest of your afternoon. See you tomorrow again. Bye for now.
Bye.
Bye.